is a much needed specialized medical care that's widely misunderstood. Palliative care is also a sensitive topic for a lot of us to talk about. So here to clarify assumptions, we have Hartford Healthcare's Dr. Sarah Dost with the Cancer Institute at St. Vincent's Medical Center. Hi, doctor. First of all, good morning. Thank you so much for being here.
Morning. Thank you so much for having me.
Well, palliative medicine is your specialty. So can you help us define palliative care? What exactly is that?
Great question. So I like to also call palliative care supportive care. Ultimately, we're a multidisciplinary team that's here to help you manage any complex issues you might be facing with your health. Dealing with side effects, dealing with decision making. Think of us as an extra layer of support.
Okay, so a lot of us might think, myself included, as hospice care and palliative medicine is sort of one and the same. Can you tell us what the key differences are?
Right, very common misconception. Palliative care is different from hospice care. You can get palliative care at any stage of your illness. Especially if you're having any bothersome symptoms or things that are affecting your quality of life. We're really focusing on improving quality of life while you're undergoing treatment. Whereas hospice care is when we're focusing on your quality of life and symptom management and other issues. However, this is more based around end of life care.
Okay, so at what point should a family ask for palliative care?
I think, at any time, if you've got pain or symptoms from your illness, if your treatment is causing side effects, if you feel worried or overwhelmed, if you need help making decisions about your medical care, or even if your family and loved ones need some extra support, we're here to help.
Have you ever had a patient say, I wish I met you sooner? People who might not have just realized that this was available to them?
Yeah, we hear it all the time. And, people come in, they may feel a little bit nervous to meet with us or say, oh, I don't need palliative care. But once we kind of do the initial visit and cover everything that we go through, people are usually very appreciative and they wish that they did it sooner.
So can you give me an example of what someone has been able to receive or what kind of care that they might not have realized was palliative care?
Yeah, so I think in terms of help, a lot of the times we do a lot of discussions around helping with decision making. So patients may not be sure what to do in terms of next types of treatment or decisions about, maybe what they want the next couple of months to look like and help with managing some of their complex symptoms. And so, we can help with that and really help improve their quality of life.
That's right. And it's just guidance, right? I mean, you're not exactly saying that somebody has to do what it is you're outlining.
Correct. That's right. We're here to kind of support and guide and serve as consultants throughout.
And you must work with the doctors, obviously, as well, just to make sure that it goes hand in hand with their actual medical care.
Absolutely. We want to always make sure that whatever we're doing and whatever we're offering is aligned with our patients' values, preferences, and what their wishes are.
All right, Dr. Sarah Dost, really great information here and so important for so many families. Thank you so much for your time today.